good, doing good, doing good. All of a sudden they're going up, and I'll ask the person, they go, yeah, I'm almost down to the bottom of the bottle. Okay, we just maybe need a new bottle, that's all.
Okay.
So just some little things to be aware of. So you get the bottle out, shake it up, take a cotton ball with some alcohol, just clean off the top. Now, you can reuse insulin syringes. Don't poke yourself, but people don't. That's again because you have insurance. Some people will use their insulin syringes 3, 4, 5 times. I usually tell people things you want to watch for. You're putting it in to draw it out, the needle bends, or if you're putting it into him, you know, went in a little hard, okay, you know it's time for a new syringe. So you kind of just gauge that a little bit. This is just a guard on the back, take it off, throw it away. There's the needle, it's very, very tiny, okay? So, I mean, it's really small. Now,
they don't even feel it.
Yeah, they usually don't even feel it when you put it in.
That whole thing goes into him?
Yeah, it's all
that whole length?
Yeah. It's really pretty short. And when you're putting it in, I'll show you now before we actually do it. Got the guard on, you're okay. What you're going to do is you're going to give it roughly between the shoulder blades. Now after you get used to doing it, you can move it around. You can go up high in the neck, you can move it back some. If you go in the same place over and over and over and over, you're going to get a little sore spot. So I tell people you move to the side a little bit, move it forward, move it backwards. You can move it around wherever you'd like. But you're going to end up, you're going to pick up his skin, just like that. He's got all this nice skin. And you're going to take the needle, and you're going to go in at about a 45-degree angle. You don't want to go like this, because it could come out the other side. So, and near the base, and you just put it in like that, and then you just push it in. You don't have to worry about hitting a blood vessel or anything like that. You're just going just under the skin. So it's very, very safe, okay? And we're going to start off, like I say, at 2 units, which is a low dose.
Okay.
I don't expect 2 units to bring him down in the normal range, but we'll see how far it does bring him down.
You want me to bring him up here?
Yep. When you draw it up, this is actually a nice syringe because it goes all the way from 0 to 12. And we're going to start at 2. So the hash mark there right by the 2.
Okay.
All right? What you do is you just put that in, draw it up. I usually draw it a little past there so you can see it. Now, if you have a little air bubble at the top, which actually we don't, but if you do have an air bubble, usually if you just tap that, the air bubble will go to the top, and you just push it back and it'll go into the bottle and you're fine. Now, if you have a little air bubble and you just can't get rid of the darn thing, don't worry about it. It's going to change the amount of insulin you're giving him slightly, and that's the only thing it's going to do. It's not going to hurt him if it goes into him, because again, it's just under the skin. It's not, going to cause an emboli or anything.
Okay.
So, you want to do it?
No.
Okay. So, again, like I said, you're just going to take his skin, pick it up, go in near the base at about a 45-degree angle, all the way in. I'm all the way into the hub.
You put it in him already?
Nope.
The needle's in him though?
The needle's in him. And then you just push it in. And that's it.
He didn't even feel it.
And then, when you're done, just clean the needle off with a little alcohol.
Like isopropyl?
Yep.
Okay.
And then just put the cover back on. Don't poke yourself. And then I usually say, keep that needle with there, because then you know which one you're using. I mean, you have the covers on the back, so you kind of know anyway. But
is that what you're talking about? That's
yeah,
the cover?
that's
Okay.
just the back cover, and you throw that away. It doesn't.
And that's the cover you're talking about. Okay.
Yep. Any questions?
I don't know.
Okay. So let's see how we do. Now, as I said before, if you're going to see most likely, if you are going to see his blood sugars drop too low, typically it's about 6 hours after he's had his insulin. So I usually tell people, because I've had people call me up and say, you know, he's acting funny, is his blood sugar too low? And I said, well, when did you give him his insulin? And if they said, I just gave it to him now, probably not, because that's when his blood sugars are going to be at the highest.
Okay.
What's going to happen is you're going to give him his insulin shot, like I gave it to him now, it's 20 to 3, so say 3 o'clock. So about 6 hours from now, so like 9 o'clock tonight, his blood sugars are going to be at their lowest, and then they're going to start to come back up again. And so, I mean, what I would say is, let's call this his evening one.
You're not doing it until tomorrow.
Do it tomorrow morning, and you know, whatever is a good time for you.
Okay.
So normally when we do bring them in to check their blood sugars, we want to do it around 6 hours after they've had their insulin. Sometimes we have to do, I'm giving you a lot of information, I know. Sometimes we have to get them in and do serial blood sugars because sometimes they metabolize it quicker or slower, and so it's not always 6 hours, sometimes it's 4 hours, and sometimes it's 8 or 9 hours, and so sometimes we need to do that, but we'll see. He may respond really, really well. We may, here in a couple of weeks, be saying, you know, let's check him for the Cushing's and let's make sure we don't have that as an extra problem. But even if we do have Cushing's, we should be getting his blood sugars at least down, you know, into some reasonable ranges where he's not drinking and peeing like a fiend. Oh, another thing I want to tell you too. He's going to develop cataracts fairly quickly. So we want to try to get his blood sugars under control kind of as quick as we can. Uncontrolled diabetes, what happens is you get swelling in the lenses, and you get that's what cataracts are. And so sometimes what happens is these dogs who don't get under control very quickly, people say, all of a sudden he can't see. And it's because he's developed cataracts now. And the thing, I'll say, okay, he doesn't have to drive a car in the beginning because cataracts normally form over years, but they will sometimes form over weeks to months with diabetes. Because he's going to lose sight fairly quickly, he'll be confused, he'll be upset. It's like, all of a sudden, I can't see like I used to. What's wrong? And you know, he'll stumble, maybe walk into some things. But usually what happens is pretty quickly then they start to adapt to it. To the fact that, oh, okay, I can't see like I used to. Things are fuzzy, things are hazy. In a darkened room, I really can't see at all because there's not enough light to get through the cataract. But usually they adapt pretty well. But we're going to try to get him under control as fast as possible to try to limit that as much as we can. All right? But don't panic if you do find that all of a sudden he's kind of walking into the walls a little bit.
So that's not neurological, it's just because he can't see.
Yes. Yeah, it's usually because they've formed cataracts pretty quick. All right?
All right.
Okay.